Hello, thank you for joining us again. This is Meridian Grace at the Awakening Health Show, and you might notice that all around me is a bunch of technology today. Computers, and I even have something here, a little wand we're going to be talking about, because today we're going to talk about something that I'm now calling a Thermo Bioscan. Its technical name, and the name that's been used in Europe for a long time, is regulation thermometry. It's a mouthful, but what does that tell you about what this actually is? So what we're going to be doing is using a bit of information from your body to understand how your autonomic nervous system is responding. Would you like to say a word or two about the way you understand thermal bioscans, Dr. Massey? What do you tell people when I...
Yes, okay, so I'm laughing. I turn green on that.
Good.
So, you know, I wear a little EM wave from HeartMath. I like to recommend that people consider getting one of those. I learned about autonomic nerve testing from Dietrich Klinghardt back in the day, and bought a heart rate variability setup and did heart rate variabilities for people. And this is like in a way, a sort of a portable a heart rate variability sort of. It's looking at something called coherence, something about the rhythms that involve the heart. And so I use it every day with journaling, and if I have issues come up, I use it with the Recall Healing books. And you're talking about a test here that's actually touching certain points on the body and then changing the temperature of the room the person's in and seeing if the autonomic nerves that are related with those points have made an appropriate change for that amount of temperature change. Or have they overreacted or underreacted? And if they've overreacted or underreacted, we look to see why that is. You'll see some graphs over here that give you some ideas. For instance, we might discover something like a root canal tooth is affecting a breast. And you can see that the presence of that root canal is what is disturbing that, because when the root canal is cleaned out, the test returns to a normal reactivity to temperature change. So the autonomic nervous system is that part of the brain that opens and closes the pupil of our eye. When we go out in the light, it closes the pupil down, and when we go in a dark room, it opens it. That nervous system never sleeps, and it's never wrong in terms of survival. It always does the right thing. So when we see something here that our medical arrogance calls out of balance, we're really just wanting to then go into the story like, why does the autonomic nervous system think it's a great idea to be overreacting or underreacting in this way? And is there something we can do about that? Because if that goes on forever, for like years and years, there can be really serious changes in the body. So this is a way of looking at things before it gets out of hand, or if it's already out of hand, what can we do about it? So
this is another one of them. Yeah, it's a great take on it, and he explained that so much more simply for you than I would have. It might have taken me at least 4 times as long. So I'm so glad that Dr. Massey started out by sharing that with you. And I just want to tell you, again, this is one of our Stitch in Time Phase 9 kind of tests, because first of all, there's nothing harmful to your body by doing this. What we use is this simple little device, and this is an extremely sensitive temperature reader. And as you can see from the computer over here, we have a picture of the face. And this test is actually done on the face and the torso, in the front and in the back. And you might see from this picture on the face that there are a lot of points actually for the teeth. So these are our teeth points here. And we're looking at different sinus points and lymphatic points. And this will actually, I'm not sure that it will let me go forward. We can try to look at all the different points here, but oh yeah, look at that. So here's the neck points, and we look at the thyroid, and we look at a lot of the lymphatic points here, and tonsils, which are lymph points as well. And let's see if it'll let me go forward again. And then this is the chest. And so we'll be looking at points that have to do with each of the organs in the body. And we'll be looking at these on the front of the body. And then I will have to go through here a little faster. And there's altogether 124 points that we are testing.
And so just for the guys out there who grew up in my day and time, when you hold up something like this and you say it's for temperature, and you see a medical person walking toward you, it's important to tell where this goes.
Yeah, so it's going to
go. This actually just touches the skin on these certain points. Okay, just so everybody can relax.
I mean, it's just like this.
Okay, like that.
I mean,
there
that's,
you go. See, yeah. So.
And you barely touch the skin. And I don't know if you can get a real close-up on this or not, but the place that's actually reading is not these little prongs. It's inside here. And so you don't even actually have to touch the skin, but this helps you to have it flat, to have the prongs there. So it's like a touch of a feather that we're using. We're not smashing this into your skin or anything like that. It's a very delicate procedure, very gentle, doesn't have any pain associated with it. But these are the points on the back of the body that we look at. And then these are the points on the breast. And typically these are just done on women. I don't know why they have a male body as pictured here, but these would be the points that we would check in depth for a woman to find out if we have any indications of unnatural growth happening on the breast. So, this test is not used so much for diagnosis, but for helping us to understand imbalances and helping us to see where we need different support. So, we have actually a test from a human being that we wanted to go through and show you and give you an idea of all the information that's here, because honestly, one of the things I have I get on my soapbox about is my deep concern about different forms of testing that we do that are actually really harmful to people. And for women who've had breast cancer, they're often asked to have a mammogram as many as 4 or 5 times a year. And the things that we know about mammograms, scientifically, is first of all that radiation causes cancer. And the other thing that we know is trauma to a tissue can cause cancer. And what we're doing is we are doing them both at the same time, which makes them exponentially more harmful. And we're asking women to do this numerous times when we already know they have a propensity to cancer, that there was an issue at some point that their body chose cancer as an expression for. And we're doing a test that we know is harmful to the body. So this particular test was designed in the very beginning to work with women to help them to know if they have any factors that we understand can contribute to cancer. And they're very different than what most of us think. For instance, we know that the molars, the second molar in all 4 of them, if there's a problem there, it acts like an electrical connection in the brain to the breast tissue and creates a disconnect between the breast and the brain, which can contribute to cancer. The breast itself has a meridian running through it, which is the stomach meridian. And so stomach issues can contribute to breast cancer. we know that the thyroid has a very direct relationship to cancer. So when we do this test, we're going to be looking at if there is an autonomic nervous system challenge to those tissues. And there are numerous types of challenges. So on our third page, and we'll be showing this to you in much better depth, so you'll be able to see this much more clearly. We're looking at the overall body. And for this woman, I was really, really happy to see how much light area, light blue she had through here, because she had had breast cancer and it was treated naturally. And this just looks beautiful, honestly, this lighter color. Many times I'll see people with dark blue, which indicates toxicity throughout her body, but she's been doing an alternative treatment for a couple of years. She's been doing detoxification and cleansing. So this is an excellent sign that she's doing some really good things for herself, okay? And, but if you look up here, you'll see this red. And we have a little area here that talks about what these colors mean. So it's different on the face than it is with the body. You see, with the autonomic nervous system, like Rich was talking about, we have the eyes that are open wide in the dark, and then or I should say the pupil that opens wide in the dark to let in more light. It's searching for light. But if it goes into the bright light, if you have a healthy autonomic nervous system, it'll get super teeny tiny, the pupil. Well, with this, we're looking at how the autonomic nervous system deals with cold. And in a cold challenge, what the autonomic nervous system will do, because it's all about preservation, is it'll take the heat from the surface of the body, and so the skin will become cooler on the outside, but the organs that have to do with the skin will become warmer to protect them from the assault from the cold. It's really brilliant, isn't it, how our body works for us. And it's just the opposite with the thyroid and the brain. We don't want the brain to get too hot. That can really hurt it. So on the head, the temperature will actually stay cold or get colder. And that way we don't overheat the brain or the thyroid. It's kind of fascinating how that all works. So each of these colors tells us something a little different. So in this case, the red is, well, let's go to the body, so that's a little bit less confusing for you. So right here we have the body itself, and the red means that the body is bringing more energy there. It needs more energy, and because we know that the body's smarter than we are. And what that means is that there's an inflammatory condition going on there. And when there's inflammation, that means our body is fighting something. It's trying to protect us. It's trying to take care of us. And it can do that with heat. It can do that, and we see it here with heat. And we can see that when it's really in full swing with creating mucus to protect certain linings and pus and things like that. And that's actually the answer from the body. But we're seeing that right now, her lymph nodes could really use some extra support. And we're going to see a little later on why that is. She's got a lot going on with her teeth. Okay? And then the color yellow, because it's different in different areas. So the color yellow here is paradoxical. And paradoxical means that it's supposed to go hot, but it's gone cold. And but it's not gone cold enough to be showing that that area is not working right. So it's going against the grain. It's doing the opposite of what we expect. And again, it's a cry for support and for some help from us and for us to look at what we can do to help that out. And then let's see here. We have some purple or dark dark areas, and these are blocked areas. And interestingly enough, we have a blocked area right here in the liver area. And oftentimes after a person has done a lot of therapy for cancer, they're going to have a level of toxins that they need to get supported. So we see a blocked area there, which basically means that that part of the body is degenerative and it's not doing what we want it to do. Now this test has so much valuable information in it. I'm just going to kind of go through these for you pretty quickly, but here is a chart of all the teeth. And each tooth has a direct connection to an organ and also a muscle, bones, and things like that. So we can see here that she has some issues, some big issues actually, going on with all these teeth. These are the ones that have speckles on them. And when we have speckles, the speckles themselves are indicative of a regional focus. And she doesn't have one of the major dental foci, which is one that has all these multiple colors in it. But we do see a dental focal area that's challenging for her. And interestingly enough, it's right next to, on either side, pretty close, to a tooth that's showing dental toxicity. So what it'll do is it's going to go through and it's going to tell us what organs are affected by this. Now, this test has been being used for over 30 years in cancer clinics, autoimmune clinics, Lyme clinics in Europe. And they've been collecting the data and then they've been creating algorithms with it. And so we're going to get the benefit of those algorithms, and I'll show you where that happens up here. So what it's going to do is it's going to take a look at her biggest issues. And here's the priorities, it's called. And the priorities for treatment for her are showing that the most important thing for her is a heavy metal signature. And then it'll say, consider chronic toxic metal or environmental chemicals as mercury poisoning long term. And it's shown that those are positive here. And so you want to look at some form of chelation therapy that might be good for her, and you might want to do some testing about that. Dietary restriction that would help her body to release mercury toxicity. And do some testing, a urinary challenge of the hair element testing, where an IV is given of a chelating device, and then you collect the urine and see what her heavy metals actually show. And then it goes through and it talks about each of the problems here. The second one was appendix, the third was her capacity to detox, and the fourth was a global immune stress, the fifth pericardial. Anyway, it goes into great depth. And it gives us explanations about what all that means and what kind of testing can be done to get really clear about it, and some basic treatment ideas to do for each one of the things that it finds. Now, we've looked at the teeth. I'm going to come down here and show you the breast area. And that's interesting. So we get a little bit of an idea. There's no completely blocked areas, but we do see that there's a lot of toxicity in the breast by the darker coloration. And so what we want to do is support her with overall detox process. My first thought would be to do something like a sauna where the tissue is all going to be taken care of. I have a fun process, I think, where I write a little script for the person's partner and invite them to spend as much as 10 minutes twice a day suckling on the breast, because that will really stimulate the breast to get more active. I might recommend that a person get into hot and cold showers and go back and forth between hot and cold to stimulate some circulation into the area. And then we might look at homeopathics. It might be really beneficial overall with systemic detox. And if you remember when I was talking about the issues, it was talking about the capacity for detoxification. So we want to support her with that, and probably that'll be something we'll want to do for her life because of her history. Now, the other thing that's quite wonderful that we do here is we go through and we have little charts that also help to make this easier to understand. And it shows you the optimal, minimal, moderate, and severe levels of problems. And we have 3 areas in the breast that are showing up as severe. So we're probably going to want to make sure that we always have her breast in mind when we're dealing and detoxification. And in this case, the issues that she has that has to do with her breasts have to do with symmetry. One breast is larger than the other, which is sometimes a sign of problems with breast cancer. She has a second molar as a problem, which I have always seen to be involved with breast cancer. And so I will always ask any patient that comes to see me who has a problem with her breast, cystic breast issues, hardening of the tissue, a family history of breast cancer, to see a biological dentist and make sure that that second molar is properly taken care of. Because many times that will be the end of the breast cancer when the tumor is taken care of, when the tooth is taken care of. She has a cold block on some of the areas of her breast, which is a big issue, and her lymphatic index was high, and the lymphatic system is very important for the breast, which is why we like to stimulate the breast, and it's great to stimulate the breast with breast massage twice a day, or lots of fun play with your partner with the breast. And we even have an issue with her liver. So all of these things are things that we want to prioritize and work with one at a time. And so it's showing us what we can do to prevent another tumor coming up for her. So I really like the idea of preventative work, and that's what we would want to do. Then we go in and we look at the overall body, and you'll see that we have a bar chart, which we can go through and look at all these different aspects of the body to find out how we're doing. And I just want to show you at the very bottom what originally was all we had available, which were these charts. Now this gets into the very specific way of working with the test overall. And as you'll see, there's these yellow areas. And the yellow areas indicate where we would want the test to fall. And these are from people who were in like perfect health, being raised in the mountains, in pristine air, had wonderful clean mountain glacier water to drink, who were, like young, healthy athletes eating nothing but the best of food. They would fall into these yellow zones. None of us are there anymore, even if we're doing everything we know how. Because we don't have that pristine air, we don't have environments free of EMFs and all the rest of it. But these are the ideal places. So there's so much information in this chart, but they will show us how much a percentage in each area of the body might be blocked or rigid, they call it, but it's blocked where there's just really no energy getting to the area. If it's only a little bit of energy that's getting into the area, or if the body feels like it has to overreact, and that's what we might call, a hyperimmune or autoimmune response. So we can see that by the colors, they're all here, and we get all this data, plus all the years of research that has gone into saying, well, if these 3 things are happening, 80% of the time a person has either had when they got tested or moved into something that we would call a dis-ease or a diagnosable problem. And if we can clear those things up, then the likelihood is that person will no longer have that problem. So the beautiful thing for me about working with a test like this is it really is, it helps us to understand where the deeper challenges are and how to encourage our body and support our body in doing what it wants to do, which is to keep us alive and keep us strong and keep us healthy. Now, this test is not just for women. This test is wonderful for all of us because it helps us to see our autonomic challenges. And they have definitely taken time to create a special chart to show us breast issues. But they've also, for men, created a special chart to look at issues for the prostate. So you can, way before any type of prostate cancer were to arise, or even a hypertrophy, an enlargement of the prostate that might make urination difficult, it helps us to see that way before it arises and see what's contributing to it, not just treat it like it spontaneously arose out of the blue. And then we would have recommendations for diet and lifestyle and some herbs or homeopathics or things of that nature. And interestingly enough, the person who developed this is very excited about recall healing. And he's going to be adding the recall healing information for each one of the organs that we see that are showing stress in some way or another or dysfunction, so that we can look at the emotional issues as well as the physical. And Dr. Klinghardt, who Richard mentioned in the beginning of our discussion about all this, is also using this in his clinic because he's also has found, like I have, that it's an incredibly valuable, non-invasive tool to help us to help ourselves. So thank you so much for joining us. And if you're interested in doing some of this work, I would love to provide you with testing here in Austin. And you can call me if you like, if you're not in Texas. And I can help you possibly find another practitioner who's doing this in your neck of the woods. Well, wishing you a beautiful, healthy day, and thank you so much for joining us. Do you want to say anything, Dr. Massey?
I think that's it, right? Okay.
That's it.